Stephen Kingsmore. I'm the director of the Center for Pediatric Genomic Medicine here at Children's Mercy Hospital. We basically decode genomes, the DNA code, the code of life, on children who are being seen at our hospital, most of whom have some type of an illness. We've had a partnership with Illumina right from the get-go. We were one of the first centers to use Illumina equipment. It wasn't even called Illumina at that point. And we've had a great relationship with them ever since, and they have really helped us a lot by making available to us a lot of new technologies, such as the one which is behind me. We were one of the first places in the world to be able to decode a human genome in 2 days from start to returning a result to a doctor, largely because we got access to a prototype instrument. We selected the content for the TrueSight inherited disease content set in a process that took months. So we started off with a preliminary set that our scientists chose, and then we gathered with about 30 physicians at our hospital who see patients with inherited diseases, and they reviewed the list and perfected it to the point where it really reflected their working needs. Overall, I'd say the thing I like about Illumina best is that the technology really works. It's fairly robust, it gives us very faithful results, and if we're going to use these technologies clinically, so a place where we're going to use them to give diagnoses to children, we really need consistency. We need a result that we can depend on that's not terribly finicky. The quality of the data, and specifically the reliability or the consistency day to day, week to week, and between instruments and operators is pretty critical. We need high accuracy, and even more important, we need consistent accuracy. We can work around somewhat inaccurate results just by doing it over and over again, but if we have inconsistency, then we really can't use technologies for clinical applications. So this is critical for us. And probably one of the biggest reasons why we stick with Illumina sequencing is that we really understand that. Very recently, in October, talked about for the first time that we were able to decode a baby's genome from start to finish in 2 days. Since then, we've been working with Illumina to shorten that time further. In a dream, we would love to be able to do that in 15 minutes, so that even in a doctor's office, we could scan a genome and give a patient a result. But as an intermediate step, we really want to do this in a time frame that allows the physician to make decisions. From my standpoint, as a physician working in a children's hospital, we are going to somewhat reinvent pediatric medicine. We're calling it genomic medicine, and basically all that means is that the genome code will be part and parcel of the medical record, and that we'll be able to inspect that as physicians in patients for whom that's relevant. It'll allow us to diagnose diseases much, much faster. It'll allow us to specify medications and dosing based on genome values, as well as stuff like how old the child is and how sick the child is. And we believe that this is going to transform medicine, that pretty much all physicians will start to be familiar with genome capabilities and will start to use that on a routine basis in the care of their patients.